concentrate on topics related to the exam. So here we can see benign and malignant tumors, 3 benign and 3 malignant tumors listed here. In benign, we have osteoid osteoma, osteochondroma, and osteoclastoma. In malignant, we have osteosarcoma, chondrosarcoma, and Ewing sarcoma. Here we can see in the list picture diaphysis, epiphysis, and metaphysis part of the bone. And we can see epiphysis is involved in giant cell tumor. Osteosarcoma involves metaphysis, and osteoma involves the cortical diaphysis part of the bone, and Ewing sarcoma mainly in diaphysis area of the bone. We'll talk about these tumors one by one as per importance. So we have now osteoid osteoma. I will discuss some features of osteoid osteoma. Osteoid osteoma is a benign bone tumor. It's mostly seen in males as compared to females, but less than the age of 20 years. It involves the cortical bones near to metaphysis, ribs, and sometimes vertebral bodies. The main thing about this osteoid osteoma is, or we can say characteristic feature of osteoid osteoma is pain at night. The individuals who has osteoid osteoma, they will complain about pain at night and followed by relief by analgesic in the name of non-steroidal anti-inflammatory drug. So very important to know, pain at night relieved by NSAIDs, less than age of 20, go for osteoid osteoma. Now, what features we'll see in X-ray? In X-ray, we will see involvement of the diaphysis with the nidus in the cortical area of the bone surrounded by a sclerotic layer. So, if patient present with pain at night, relieved medication like non-steroid anti-inflammatory drugs and X-ray showing nidus, think about osteoid osteoma. We'll go for the next benign bone tumor, that is osteochondroma. It's also known as exostosis. It's common benign tumor. It's involved the metaphyseal area of the long bones, and we can see the outgrowths going away from the joint. That is the characteristic feature of osteochondroma. As name indicates, osteochondroma, so it means chondroma means cartilage, the bony tumor involving the cartilage, and especially in metaphyseal area, and the age related involvement is seen in the age of 10 to 20 years of the age, mostly in young patients. The treatment of the osteochondroma is resection. It can be a one osteochondroma in a body or multiple osteochondroma at the same time. Let's go very important bony tumor that is called giant cell tumor, also known as osteoclastoma. This is a very important tumor regarding the exam. It came many times. The characteristic features of the giant cell tumor osteoclastoma is involvement of the epiphysis. You see here the picture, the epiphysis is involved. If you see X-ray, the epiphysis is involved. This tumor presents at the age of 20 to 30 years. So epiphysis is involved, and the main characteristic feature of this tumor is soap bubble appearance. If you see this X-ray, you will see the picture of soap bubble appearance. And this destruction is caused by the osteoclast, so this condition is also called osteoclastoma. We should remember both names. Benign aggressive bony tumor involving epiphysis at the age of 20 to 30 years. So bubble appearance, the diagnosis will be germ cell tumor. Our next topic is osteosarcoma. This is a malignant bony tumor, primary malignant bony tumor involving the metaphyseal area. The characteristic of osteosarcoma is it presents in extremes of age, means in young less than 20 years and old more than 60 years. So bimodal, will be found in both. It is the 20% of malignant bony tumors. It is secondary involvement, or we can see the osteogenic sarcoma in patients of Paget's disease. This osteogenic sarcoma involves metaphysis of the long bones, and in X-ray there is a characteristic periosteal elevation that is called Codman triangle. So osteosarcoma, malignant bony tumor, extremes of age, young less than 20, old more than 60, metaphyseal involvement, and Codman triangle, and other features all the same: weight loss, pain, and the treatment is always resection plus chemotherapy. This osteosarcoma can come in exam with both names, osteosarcoma or osteogenic sarcoma, and very, very important for the exam point of view. Our next malignant bone tumor, this is coming in many times in the recalls. This is called Ewing sarcoma. The characteristic features of the Ewing sarcoma. This is seen in children less than 15 years of old. Males or boys are affected more than the females. It involves the diaphyseal area of the long bones, and the patient can present with pain, fever, and the X-ray shows a characteristic pattern of periosteal elevation because of bony lesion. So the multiple layers are raised. The picture is like a onion peel appearance. So once you see any scenario with in children with pain, fever, and X-ray showing onion peel appearance, only think about Ewing sarcoma. The treatment of Ewing sarcoma is resection and chemotherapy. Let's talk about the few scenarios according to the exam. A 47 years old male presents with asymmetric swelling on the right lower rib cage. On examination, the swelling is tender. A chest X-ray demonstrated localized bony destruction at the lower costal margin with areas of calcification. Age 47, and the involvement is lower costal margin, swelling, lower rib cage. So means all these are the cartilaginous and flat bone, and it's aggressive with calcification. The diagnosis will be chondrosarcoma. It's less important than other questions, so let's move for the others. 15 years old boy attends the emergency department with pain in the lower leg with fever. On examination, there is a tender irregular swelling at the tibia. X-ray of the leg shows lytic lesion with a laminated periosteal reaction. So the scenario, you can see age is 15 years. So presentation is with the pain and fever, and examination shows the swelling in the leg tibia. In X-ray, there is a characteristic lesion, lytic lesion with laminated periosteal reaction. So with the age and the presentation, and the X-ray finding, we can directly think about the Ewing sarcoma. So this scenario 2 is for Ewing sarcoma. Answer is C. A 22 years old male presents with an enlarging painful lesion in his distal femur. An X-ray of the femur shows ill-defined lesion with calcification associated with elevation of the periosteum. So age is 22 years of old, so extreme of age, and there is a periosteal reaction in the X-ray. So this is the scenario for the osteogenic sarcoma. Our answer will be I. So let's go to the extreme of other age. A 72-year-old man develops a painful enlarging mass in his left tibia. An X-ray of leg shows periosteal elevation and anterior bowing of the tibia, and chest X-ray reveals multiple discrete lesions in both lungs. So age, extreme of age, and involvement and periosteal reaction elevation, Codman triangle. As we discussed before, this is the case of osteogenic sarcoma. So answer of 3 and 5 is I. Our last question is a 20-year-old man presents with a 2-week history of pain in his thigh that is worse at night. The pain is relieved promptly by non-steroidal anti-inflammatories. An X-ray of affected thigh demonstrates a radiolucent area within the femur surrounded by a ring of dense bone. This scenario of nothing to think about, directly go for osteoid osteoma. So our answer is F. For question 4, F. So uh, I try to make these bone tumors easier for you. Mostly the questions are coming from Ewing sarcoma and osteogenic sarcoma and giant cell tumor. So these mainly three are important. Just keywords to remember with you and see the age. Then hope it will be easy for you.